McCarthy. I'm going to be performing the rest of the NG tube checkup, so I'm going to scan the room. And so now that I already have everything set up, I would coil the end of this tube in my hand and then release. And then I would lubricate the 4 inches with the water-soluble lubricant that I have on here. And then I would instruct the patient to extend his head against the pillow, and I will insert gently and slowly until I get to the nasopharynx. So once I get to the nasopharynx, I would instruct the patient to sip the water we have right here, and there would normally be a straw in there. And every time he took a sip, I would advance 1 to 2 inches while rotating at 160 degrees. So and I would insert into my marked tape. And if I ever met resistance, or if I felt a force, I would stop. And if the vital signs dropped, or if the patient started to cough, if the vital signs started to drop, I would stop. And if the patient started to cough, I would withdraw to the nasopharynx until normal breathing occurred. And so now since it is at the right placement, I will temporarily secure this to that cheek. And then now I would take a tongue blade and my pen light, and I would look at the back of the throat to check for placement. And then I'm going to take my 60 milliliter syringe, and I'm going to insert and pull back, looking for gastric contents. I would get the pH of those contents, and I would also get an x-ray to verify placement. So now I can remove this, cap this when it's not in use. And so now I am able to remove the temporary tape. I'm going to remove this, and I would prep the nose for the tape. So I prep the nose with an alcohol pad, and then I would tape to the nose, and we use the tape like this. So I would tape it to the nose, and then I would tape it to here. And I would clip to the gown, and I would allow slack so they could turn their head. I would note the exit marking with an indelible marker so it's a guide for displacement. I would put a piece of tape across the nose with my initials, the date, and the time. And then I'm able to do the low intermittent suction. So we would have the suction regulator, and we would set it to low intermittent suction. And so you cap this when it is not in use, but since we are going to hook it to the intermittent suction, I would uncap and hook it up to the intermittent suction. And you always want the blue pigtail above the stomach, but I do not have a place to place it, so I'm going to place it on the bed. And then I would leave the bed no lower than 30 degrees. I would lower the bed and raise the side rails back up. I would make sure the call light was in reach, and I would assess the patient's comfort. And then I would clean up my supplies. I'm going to take off my gloves, and I'm going to perform hand hygiene. And now I'm ready to document. When I document, I would do the type and the size of the tube. I would do the location, how it's secured, how I verified placement, the type of suction, so it's low intermittent. I would do the patient's tolerance, the procedure, the color, amount, and consistency of secretions. And so now we are going to remove it. So to remove it, I would verify the order, perform hand hygiene. I would explain the procedure to the patient. I'm going to put clean gloves on. and I will raise the bed and lower the side rails. I'm going to auscultate the bowel sounds. I'm going to do that. And then I would place the patient in a high Fowler's position. I would turn the suction off. And then I'm going to get this. And then I'm going to remove the tape. And then I would direct the patient to take a deep breath and hold his deep breath while I remove it smoothly and steadily onto the towel. And I'm going to kink the tube before I remove it, so I have it kinked. Then I'm going to remove it fast. I'm going to put it in the towel so I can gather all that. And then I would measure the drainage if there was any. I would document the procedure, and I would also provide oral care for the patient, and then I would document the procedure.